Hi everyone, I'm Dr. Veronique, Chairperson of the Singapore Cancer Society Breast Cancer Awareness Committee and Head of the Department of Breast Surgery at the Singapore General Hospital and the National Cancer Centre, Singapore. A mammogram is a low-dose X-ray examination of the breast. It allows the doctor to look deeply inside the breast to find out evidence of early-stage breast cancer before it can be felt. During a mammogram, the breast is placed between two plastic panels and gently compressed for a couple of seconds. Each breast is compressed twice in 2 dimensions, and the total amount of time is about 3 minutes. After the images are taken, the digital images are processed and sent to the hospitals to be evaluated by 2 radiologists. Now let's invite our radiographer, Ms. Gracio, to come and share a little bit more about what she does on a daily basis. Gracio.
Hi, Doctor.
Hi.
Hi, everyone. I'm Gracio. I'm a radiographer here at Singapore Cancer Society. And on an average basis, we take about 20 patients, and then in a typical appointment, it will take about 30 minutes. All right. And then this is our machine. We will ask the patient to undress waist up. So the breast will be compressed by this clear paddle, and then the compression will take for about 10 to 15 seconds. So each compression, I need you to be still and then relax, so at least the picture will be good. And then we will do different position for the breast to have a different view. Okay, so I have some tips for women who wants to do mammogram. So much better to wear a top that easily to be removed, and then avoid using powder, lotion, deodorant, and perfume during the day of your procedure. And then especially, you need to relax.
Gracio, what are the common questions that the patients ask you on a daily basis?
Okay, so the most common question is it painful? So for patient coming regularly, they know how to relax, and then the pain is manageable. So the patient might feel a little bit uncomfortable because of the compression, but later on, it will be much lesser and bearable.
So it's not as painful as one would think. That's very good to hear. So what happens after the screening images are taken?
Okay, 4 images will be reviewed by the radiologist. And then after 4 weeks, the letter will be mailed to the patient. And then if there's an abnormality found, they will ask the patient to make appointment in the assessment center.
And here is where I come in. This is an image of a mammogram that was taken for breast cancer screening. When reviewing a mammogram, the radiologist is looking out for clusters of calcification, any small tumors, or distortion of tissue that may suggest early disease. There is no need to panic when your screening center informs you of an abnormal finding. A borderline or abnormal screening result does not always mean that you have cancer. It simply means that we are very careful and would like to do more tests to fully evaluate something that is noted. There are many different types of benign breast changes, and studies have shown that only 1 in 10 abnormalities detected on screening mammography is cancer. At an assessment center, an ultrasound scan or specialized mammogram will be performed to look more closely at the abnormality that was originally detected. Sometimes a biopsy may be recommended, but having a biopsy doesn't mean that there is cancer. A large proportion of the results do come back as benign breast diseases. Even if cancerous cells were noted on the biopsy, there are many effective treatments today that effectively cures a woman of breast cancer. Early detection does save life, and we would like to stress the importance of breast cancer screening. Here at the Singapore Cancer Society Clinic at Bishan, we provide breast cancer screening at no cost for women with a blue or orange CHAS card who are aged 50 years and above. In celebration of Breast Cancer Awareness Month, the Singapore Cancer Society is also providing a $25 funding assistance on top of prevailing subsidies to eligible women in the months of October and November. Do go to the Singapore Cancer Society website for more information and to book a date for your screening mammogram today. Having a mammogram is a simple process, and the slight discomfort is worth it if we pick up breast cancer at an early, curable stage. We do hope that everyone becomes an advocate And do give your loved ones a nudge to ask them to come for their breast cancer screening today.